Childhood trauma can leave a lasting imprint on an individual's life, affecting their experiences and relationships well into adulthood. From abuse and neglect to instability and insecurity, childhood trauma can have far-reaching effects on a person's well-being and ability to connect with others. But what exactly happens when trauma from the past haunts our present and future? How does it impact our relationships and interactions with others? Join us as we explore the fascinating and often heart-wrenching world of the effects of childhood trauma on adult relationships. Let's get started. Number 1. Difficulty trusting others. Difficulty trusting others is a common effect of childhood trauma on adult relationships. This can stem from a history of abuse, neglect, or instability in early life, which can cause an individual to view others as untrustworthy and prone to hurt them. This can lead to difficulties in forming close relationships, as the individual may be guarded and find it difficult to let others in. It can also lead to feelings of isolation and a sense of disconnection from others, as well as a fear of being hurt or betrayed again. This lack of trust can also affect work relationships, friendships, and romantic partnerships, and can be a barrier to building and maintaining healthy, fulfilling connections with others. Number 2. Difficulty with intimacy. Difficulty with intimacy is another common effect of childhood trauma on adult relationships. Intimacy involves emotional closeness, vulnerability, and a sense of connectedness with others. However, for individuals who have experienced trauma in childhood, the idea of opening up and being vulnerable can be frightening and triggering. They may have developed defense mechanisms such as emotional numbing or avoidance, which can make it difficult for them to form close and intimate relationships. This can lead to feelings of isolation and a lack of fulfillment in relationships, and can also impact their ability to form meaningful connections with others. It can also result in a pattern of toxic or unhealthy relationships, as the individual may seek out partners who are emotionally distant or who do not require intimacy. Number 3. Fear of abandonment. Fear of abandonment is another common effect of childhood trauma on adult relationships. This fear can stem from experiences of instability, neglect, or loss in early life, and can cause an individual to view relationships as precarious and susceptible to ending at any moment. As a result, they may cling to partners, avoid intimacy, or be constantly on guard in relationships. This fear of abandonment can also lead to difficulty setting boundaries, and can make it challenging for the individual to form healthy relationships with others. It can also result in a pattern of unhealthy relationships, as the individual may seek out partners who are emotionally distant or emotionally unavailable, or may avoid relationships altogether. Number 4. Emotional dysregulation. Emotional dysregulation is a common effect of childhood trauma on adult relationships. This refers to difficulties managing emotions in a healthy and adaptive way. Individuals who have experienced trauma in childhood may struggle to control their emotions, leading to outbursts, panic attacks, or other extreme reactions. This can make it challenging for them to form and maintain healthy relationships, as their emotional reactions may be perceived as unpredictable or overwhelming by others. Emotional dysregulation can also result in a pattern of unhealthy relationships, as the individual may seek out partners who are emotionally unstable or who reinforce negative coping mechanisms. This difficulty with emotional regulation can be addressed through therapy and other forms of support, but it may take time and effort to overcome. Number 5. Difficulty setting boundaries. Difficulty setting boundaries is another common effect of childhood trauma on adult relationships. Boundaries are the physical, emotional, and mental limits that individuals set for themselves and others in order to maintain their sense of self and protect their well-being. However, individuals who have experienced trauma in childhood may struggle to set and enforce boundaries, due to a history of violation or lack of control in early life. They may also struggle to recognize and assert their own needs, leading to a pattern of toxic or codependent relationships. This difficulty with boundaries can also make it challenging for the individual to form healthy relationships with others, as they may be unsure of how to set limits and may struggle to assert themselves in a relationship. Number 6. Hypervigilance. Hypervigilance is a common effect of childhood trauma on adult relationships. Hypervigilance refers to a state of heightened awareness and suspicion, where an individual is constantly on guard and anticipating danger. This can stem from a history of abuse, neglect, or instability in early life, causing the individual to view the world as a threatening place. In relationships, this can lead to difficulties with trust and intimacy, as the individual may be wary of others and struggle to let their guard down. It can also result in a pattern of toxic or unhealthy relationships, as the individual may seek out partners who reinforce their sense of danger or who are emotionally distant. This state of hypervigilance can be distressing and exhausting, and can make it challenging for the individual to form healthy relationships with others. Number 7. Negative self-image. Negative self-image is a common effect of childhood trauma on adult relationships. This can stem from experiences of abuse, neglect, or instability in early life, causing the individual to view themselves as unworthy or unlovable. As a result, they may struggle with low self-esteem and a negative self-perception, which can affect their ability to form and maintain healthy relationships with others. They may also seek out partners who reinforce negative beliefs about themselves, leading to a pattern of toxic or unhealthy relationships. This negative self-image can also make it difficult for the individual to assert themselves in relationships, leading to feelings of inadequacy and a lack of fulfillment. This negative self-image can be addressed through therapy and other forms of support, but it may take time and effort to overcome. Number 8. Avoidance of close relationships. Avoidance of close relationships is a common effect of childhood trauma on adult relationships. This can stem from experiences of abuse, neglect, or instability in early life, causing the individual to view relationships as dangerous or untrustworthy. As a result, they may avoid intimate relationships altogether, or may struggle to form and maintain close connections with others. This avoidance can be a form of self-protection, as the individual seeks to avoid the possibility of being hurt or betrayed again. However, it can also lead to feelings of loneliness and isolation, and can make it difficult for the individual to form healthy relationships with others. Number 9. Substance abuse or other unhealthy coping mechanisms. Substance abuse or other unhealthy coping mechanisms are a common effect of childhood trauma on adult relationships. Trauma can have a profound impact on an individual's mental health, leading to feelings of stress, anxiety, or depression. In an effort to manage these emotions, individuals may turn to unhealthy coping mechanisms, such as substance abuse, self-harm, or disordered eating. These coping mechanisms can provide temporary relief from emotional distress, but they can also have a negative impact on relationships and overall well-being. Substance abuse, for example, can cause mood swings, erratic behavior, and decreased ability to communicate effectively, making it difficult for the individual to form and maintain healthy relationships with others. Number 10. Poor communication skills. Poor communication skills are a common effect of childhood trauma on adult relationships. Communication is an essential component of healthy relationships, allowing individuals to express their needs, feelings, and boundaries effectively. However, individuals who have experienced trauma in childhood may struggle with communication due to difficulties with trust, emotional regulation, and self-expression. They may struggle to express themselves in relationships, leading to misunderstandings, conflicts, and a lack of fulfillment. They may also avoid communication altogether, leading to a pattern of unhealthy relationships or disconnection. Poor communication skills can be addressed through therapy and other forms of support, but it may take time and effort to overcome. Improving communication skills can help individuals to form healthier relationships with others, and to assert themselves effectively in relationships. In conclusion, childhood trauma can have a significant impact on an individual's ability to form and maintain healthy relationships in adulthood. However, it's important to remember that there is hope and help available. With the right support, individuals can overcome the effects of childhood trauma and build fulfilling relationships with others. Whether through therapy, support groups, or other forms of self-care, there are many ways to heal and move forward. So, let's continue to raise awareness about the impact of childhood trauma, and work together to support those who have experienced it, so they can have the fulfilling and meaningful relationships they deserve. Thanks for watching. If you find this video helpful, share it with your friends, and don't forget to subscribe and give us a thumbs up. See you in the next video.